Thank you, Leah. Thank you, Sorry, for hosting this webinar today. And thank you all for joining us today for this presentation. Today, we're going to talk about resident councils in long-term care homes. And we're going to focus specifically on challenges and ways to address them. Um, I want to point out that this webinar is largely based on insights from my recent report called A Bridge Over Scary Water, which is a quality improvement project that focused on my interviews with 50 ombudsmen from 32 states about the strategies they use and the barriers they face when they're trying to address residents' fear of retaliation, when residents are considering voicing care concerns or mistreatment in long-term care homes. That report and project was funded by the Connecticut Long-Term Care Ombudsman Program. It's also informed by a prior report from 2023 that is called They Make You Pay. It was funded by the Long-Term Care Community Coalition. It's a study that examined the lived experience of residents when they fear retaliation or when they experience threats of retaliation or actual retaliation. Now, many of you know, but I want to just provide a brief background about resident councils. A resident council is an independent and organized group that meets on a regular basis to promote and enhance the quality of life and care for all residents. A residence council's most important and defining feature is that it is made up of residents, it's directed by residents, and it works for residents. So this is based on a guide. This is from a guide, a wonderful, wonderful guide that came out recently. It's entitled A Guide to Strengthening Resident Councils in Nursing Homes. It was developed by the Moving Forward Nursing Home Quality Coalition. And I will refer to this guide as we go along here. I also include a link to a video describing what is resident council and why they are important from the Connecticut Long-Term Care Ombudsman Program. So here is a link to the guide that I mentioned from the Moving Forward Coalition, but also another wonderful toolkit on resident councils from the Texas Long-Term Care Ombudsman Program. So I want to point out that this webinar does not go into detail into the basics of resident councils because it is assumed that ombudsman viewers already have this knowledge. So I will not cover how to set up councils, bylaws, the different structures and models for having resident councils, how to run the council, the role of the council president, and the role of designated staff person. There's also an important distinction between nursing homes and assisted living residences. We know that nursing homes are regulated by the federal government, that is the Centers for Medicare and Medicaid Services, or CMS, and they are different from assisted living residences that are regulated by states. And yes, there's different terms used to describe assisted living in different states. So the requirements pertaining to resident council and assisted living vary greatly by state. Therefore, when advocating for residents in assisted living, we need to consult with the specific state regulations. I also included a consumer voice fact sheet about resident councils in nursing homes. And I want to point out that CMS has a specific state service deficiency citation, FTAG F565, that is representing a violation of residents' right to organize and participate in resident groups in the nursing home. And as part of the requirement, the federal law requirements, the nursing home must provide a resident group, if one exists, with a private space. Staff and others may attend only at the group's invitation. The nursing home must provide a designated staff person who is approved by the resident group and the nursing home. And that individual is responsible for providing assistance and responding to written requests that result from the group meetings. But again, this individual can attend and assist only if invited by the resident council. And the nursing home also must consider the views of resident group and act promptly upon grievances and recommendations. It also must be able to demonstrate their response to concerns and the rationale for such response. And the guidance for this FTAG, first we have to mention that this requirement does not require that residents organize a resident council, okay? However, whenever residents wish to organize, they must be able to do it without interference. Additionally, they must be provided space and privacy for meetings and staff support. Here is a quote of a resident older adult living with early stages of Alzheimer's disease in an early study that I conducted in a secure dementia care home of an assisted living residence. He said, "Nobody asks us what we're doing. We're cut off. Nobody inquires about how things could be improved. If they only would ask us, things could be improved." A couple of weeks later, the same person said angrily about management, "Nobody ever asks us what we think. Why the devil they don't ask us what we're thinking? They could benefit from that. I really don't understand why they don't ask us." So the ombudsman that I interviewed for the report, A Bridge Over Scary Water, shared their views about how they see the value of resident council. So one of them said, "Resident councils are so important to the work that we do, not only to the work that we do, but to the possibility for change. It is really the only collective voice." She added, "A surveyor going to a resident's room to ask questions, if you have one of these very reluctant residents, they are not going to get much. You know, a resident who is scared of retaliation, especially if they speak with a state survey agency person." So she added, "I think the resident council is a really important place to affect change, or to affect at least knowledge, or to get the knowledge. But if you got some stuff going on in the background, it is not helpful." We're going to go into detail and open up what that stuff means on the ground. Many ombudsmen spoke about the critical role a well-run, resident-run council can play in addressing residents' care concerns and fear of retaliation. One of them said, "Resident councils are very powerful, I have found in my area. I have a lot of good success with my resident councils." Another one said, "Resident council is one of the most important things in a nursing home, as residents can come together. Being one person standing out alone is a super scary thing to do. But if you are one person surrounded by other people that are like, yes, this is a problem, it's empowering." Another one said, "I love resident councils and family councils for the same reason. They can be very effective in addressing concerns in a way that is less likely to have consequences for a specific person." Another said, "I think resident council is great for residents. I know that the health department looks at all the minutes. If there are issues, that the administrator has to answer those issues. I think it is a good benefit for the residents to join. They can have it anonymous. There doesn't have to be staff there." So in the Moving Forward Coalition Guide, residents from around the country wanted other residents to know that you are not alone, referring to people living in long-term care homes. And that is very important because fear of retaliation often occurs in isolation, where the perpetrator of threats of retaliation or actual retaliation isolates the individual, and they are fearful to speak up. So let's talk about resident councils in an ideal world. And then we're going to dive into the challenges on the ground. So in an ideal world, it has to be resident run, not staff run. There's got to be a strong president who is informed and empowered, that takes the job very seriously and is respected by others. It has to be private meetings, and staff attends only upon invitation. It has to be a private space to allow residents to freely discuss some of the concerns that they may have. It has to be anonymous. The idea of the resident council is that it's anonymous. It's a great way to handle things anonymously. No one knows out of the group who said what. The council doesn't single out one individual. It takes away that fear. It's one voice. They can say the resident council said. There's power in numbers. It's a collective voice. It can have a group effect. It's a community of peers. It provides a safety zone, a safe place. And again, it can be an isolation breaker. Sometimes people feel like they are in a silo. At council, they don't feel so alone in making a complaint. You're not alone. You're not taking a problem yourself. Again, in an ideal world, the council can be beneficial because multiple people are aware of the concern. It's a way of publicly addressing an issue out in the open versus behind closed doors. And by out in the open, it means only amongst residents. And by behind closed doors, it actually means behind closed doors of a bedroom where fear of retaliation or actual retaliation could occur with individual staff member. So the resident council can provide peer support where residents can support each other with their thoughts and concerns and experiences. It's a built-in support system. It's an excellent forum to educate on all their rights and in particular talk about a fear of retaliation. Residents come to the realization during council that it's not just them. They realize that they are not the only ones going through that. Hey, it's not just one person, it's 10 of us. Initially declined, a resident initially declined, but then they went ahead and identified by name a physically rough and evil CNA because others mentioned her name. The CNA even admitted, I'm kind of abusing them, attributing it to being short-staffed. So resident councils can be the eyes, the ears, and the voice of other residents as well. They are the voice of all residents in the care home. So one council president made it a point every day during the month between resident council meetings to meet 3 or 4 residents each and every day and ask them the simple question, what do you want me to bring up at the meeting? The president gathered all the information, compiled it, summarized it, and then when the day of the council came, he or she were prepared to share all other residents' concern during the council. Mary, who was a nursing home resident in Connecticut, said in an educational film on fear of retaliation in Connecticut, she said, I got on the PA system 3 days in a row before, and I would say things like, this is your home, and if you want changes, you should come down and talk about them. So in an ideal world, resident councils should be a structured process through the use of the grievance form, the group grievance. And I include here a link to a sample grievance form and the page numbers in the Texas Resident Council Toolkit where you can find that sample grievance form. So a good resident council should have good quality, minutes taking, and administration that follows through. We're going to go into detail into those issues shortly. And surveyors checking minutes and holding administration accountable. One ombudsman saw it as a very powerful tool. Resident council could be preventive in nature. They can help identify problems early before they become bigger problems that may involve outside agencies, like the health department. Now, activity directors can help facilitate it effectively if they're invited. One ombudsman said that 99% of their activity directors that she or he work with are fabulous. I find the activity directors, except for one, my whole career, the most trustworthy. Another one said they are almost the most facility neutral people. And of course, certain social workers can help as well if invited by the resident council. But we know that social workers are often working between a rock and a hard place, between the residents' needs and administrators' pressures. So we need to take that into account. Now, there's a caveat with regards to activity directors helping to facilitate resident councils, because some residents may have a bunch of complaints about meaningful engagement, so they don't want to make complaints about activities in front of the director. It's uncomfortable. In a really good resident council, there must be a staff buy-in, not only direct care staff, also indirect care staff and support. But it really all starts from the top. That is owners, administrators, and directors of nursing and managers. So the administrators and the director of nursing's view of the council could span anywhere from being perceived as a headache and an adversary and a burden, all the way to perceiving it truly, truly as an asset. A common challenge identified in the Moving Forward Coalition Guide is limited or lack of administrator support of resident councils. It says, if the administrator does not support the resident council, other staff may be more likely to have negative attitudes towards the council. The importance of the administrator's active, consistent, and open support for the council cannot be emphasized enough. Here's one example. The administrators should monitor, that is, have a process for how issues are raised by the council and are resolved. This could be part of a quality assurance performance improvement. We're going to return to that last part at the end of this presentation. So in one nursing home in Florida, during a surveyor's observation of a resident council, 16 residents expressed fear of retaliation related to reporting or filing grievances. They said about staff, they get back at you. They sweep things under the rug. There's no point reporting. They never acknowledge what is going on. No point submitting a grievance. Don't write down our names. We don't want to cause trouble. The residents reported that they had not filed grievances related to staff who were mean to them. They said, we can't say their names and we don't want to pay the price. Interestingly, the administrator of the same nursing home, when he became or she became informed about these extensive concerns among residents, they said, I am surprised that this is the culture. I am not aware that residents are afraid of voicing concerns. My door is always open. And I think this touches upon a major theme in my report, A Bridge Over Scary Water, whereby there's a vast difference between administrators that take what I call the 30,000 feet approach, kind of tucked in their offices, barely ever showing up on the floor, versus administrators that understand the value of spending as much time as possible on the floor, knowing each one of the residents and developing close, trusting relationships with them so that residents feel comfortable to approach staff, managers, and them with concerns. So moving here to the section about challenges with resident councils, as came up from my interviews with 50 ombudsmen in 32 states. So one of the challenges that you often see is that it's staff-run as opposed to resident-run council. One ombudsman says, it's rare in our area that it is only resident-run. Another concern is that when the resident council work is being dismissed and compromised versus being empowered to affect true and meaningful change. One ombudsman said, let them know that this is a resident-driven, not facility-driven. Once residents run the council, that makes a really big difference as far as the success of the council and speaking for other residents. Other challenges have to do with staff and managers' presence during the council. One ombudsman said, if you have a bunch of staff in there, I think residents aren't going to say much. They're not. I think it's intimidating. Residents are fearful to speak up when staff are in the room. For example, one staff was quoted telling a coworker, hey, resident so-and-so complained about you at resident council. They said that you did so-and-so. The ombudsman explained, what that does is it sets up this little paradigm where residents are somewhat targeted because of speaking up at council. So the expectation should be that residents should feel free, should feel comfortable speaking freely about their concerns, care, rights, and activities without being intimidated, silenced, or identified as complainers. This is coming direct quote from the guide of the Moving Forward Coalition. So here are some ways in which certain staff managers compromise resident councils. Of course, there are many staff and managers that do it well and are fully supportive and understand and cherish the value of resident councils. But here we're talking about ways in which those councils could be compromised and are compromised. The first way is not educating residents and staff about resident council rights, not supporting resident participation, and then going into not respecting residents' choice to have a private council, interrupting, controlling, influencing, dismissing, intimidating, retaliating, taking minutes in unhelpful ways or even harmful ways, and not following through on concerns voiced. One ombudsman said, to be honest, sometimes staff, they don't even know the difference. They don't even know any better. It's just the way it has always been. She added, it's a problem. It's a problem. It's something we're trying to work with. So ombudsman spoke about the importance of educating residents about resident councils. One of them said, it is important to inform residents of what residence councils are because a lot of times they don't know. Many residents don't know their rights related to resident councils. Here are a few examples in nursing homes. The right to hold resident council privately. The fact that staff and managers are permitted to attend only upon invitation. And the right to voice care concerns without retaliation and without fear of retaliation. One ombudsman told a resident, you know you don't have to have that person in there. The resident said, oh, we weren't aware of that. Here is a story in a nursing home in Texas. Resident council meetings were always held with the activity director present. 10 residents were unaware they had the right to organize and participate in a group meeting in a private space, and that staff could only attend if invited by the council. All residents expressed surprise at this information, and all residents stated they would feel more willing to express their views without a staff person being in the meeting. The activity director stated that they did not know that the council was supposed to meet privately and that she had to be invited. The administrator stated that the consequences of the residents not meeting alone would be fear of retaliation from staff if they expressed their feelings and concerns. One ombudsman with over 30 years of experience in this role said, if you do it in a straight line, residents get it. They know how to take the message. It works when you do it correctly. That is, when you educate residents about residents' councils. Other challenges include long-term care ombudsman programs not having the manpower or resources to help residents set up councils or for ombudsmen to be present in councils. We all know that the ombudsman to long-term care bed ratios vary greatly across the country. Many ombudsman programs have ratios far from the recommended 1 to 2,000 ratio, and yes, it is outdated and needs to be revisited, including for rural geographic areas. And this challenge occurs while there's a need for ongoing support, guidance, and education for residents and for staff. In the case of residents, we have many often coming in newly admitted residents, and for staff, we're all aware of substantial staff turnover in many nursing homes. There's also challenges that have to do with the president of the resident council. But first, ombudsman highlighted the critical role of resident council presidents in the success and the effectiveness of the resident council. One ombudsman said, most facilities do not do proper resident council meetings. I think part of it is that they don't take the resident council president role seriously. She added, it all comes down to the resident council president. And I believe that ideally, a resident council president should be a leader who is informed, educated about resident rights and resident council rights, that is empowered, organized, professional, respectful, and respected by all. Here is an example of a problem that presidents sometimes have taken it off and going on their own agenda, which has nothing to do with what the resident council should be. And I included here a picture of Lori Tanchin, who played Susan in the Netflix film A Man on the Inside, where an older adult goes in undercover into a retirement community after a jury was lost, and he was trying to gather evidence about who might have been taking it. So she played the president of the resident council in that film. Other challenges in resident councils have to do with lack of participation by residents, whether it has to do with decline in health or disability. Residents who are hard of hearing, well, they can use assistive technology such as microphone. In fact, one president of resident council considered stepping off the role because they said that they couldn't hear well during meetings. But a microphone was brought in, and with the microphone, he or she were able to hear well and continue in their role. So disabled residents who want to attend the council but don't receive assistance to get in there and participate. An innovative approach in Connecticut, some council meetings can be projected on the bedroom's wall for residents, for example, who can't leave their bed for different reasons. Another challenge is when the councils turn into gripe sessions, and when residents just complain and complain and nothing gets done. And that's also a reason why residents won't attend those councils. Another challenge occurs when certain residents dominate the meeting with their personality, or residents not backing each other up. One resident says, well, I brought something up last time and you didn't back me. Or residents even retaliating against other residents. For example, one resident was fired um, after being voted in as the secretary of the council. Another challenge may occur related to residents with dementia. We know that nursing homes, many of them have high proportion of residents in advanced stage of dementia, or if there's a secure dementia care settings operated within assisted living or nursing home. One ombudsman said, I've got two care homes that it's really hard to get people at the resident council because of a high percentage of individuals with moderate to severe dementia. There are very few alert and oriented residents in those buildings. Here's an example that an ombudsman gave in the context of dementia. She said, here how it will go. The staff will say, okay, how is nursing? Nobody says anything. Okay, how is housekeeping? Somebody may say they lost a red shirt last week. Okay, we'll try to figure it out. When I'm there, they'll say, how is nursing? Nobody says anything. And the staff person starts moving on to the next department, and I'll say, excuse me, do you mind? And I'll ask, how are you getting your call lights answered? That will start the conversation. She added, are you getting your medications on time? Things like that. But if I'm not there, those things don't really happen. If I'm not there, they just breeze over everything. So I want to briefly touch upon misconceptions related to people in early stages of dementia. Unfortunately, many of them are often automatically written off as incapable of participating meaningfully in those councils. But when elder-friendly and dementia-friendly conditions are created thoughtfully and proactively, it is possible for people in early stages of Alzheimer's and other forms of dementia to meaningfully participate in resident councils. I saw it firsthand during my doctoral dissertation study in a secure dementia care home in Massachusetts. In fact, one of the residents who participated in that council said, I think a meeting of this type should be held on a regular basis. She added, the meeting is important. It gives us a chance to voice our opinions. She paused and then she said, as long as we know that someone is listening. Here are 3 studies that help break that misconception about people living with dementia. The first study showed that many people with dementia were able to appropriately respond to questions about their quality of life. The study concluded that many people with mild to moderate dementia can be considered good informants of their subjective states. Another study found that many people in early and middle stage of the disease are often able to communicate their choices, share their preferences and values, and report abuse. Another study among older adults in emergency departments found that for 59% of individuals with cognitive impairment, The assessors were confident or absolutely confident in the person's ability to report abuse. And then they provide the breakdown with different stages of cognitive decline. The researchers stated and acknowledged, however, that the ability of those in advanced stages of the disease to recognize and report mistreatment may be more challenging. And while we earlier saw that many ombudsmen believed that resident councils could be very powerful and effective in bringing meaningful change in residents' care and life, some ombudsmen thought that resident councils are not effective. One ombudsman said, resident councils are great on paper. I don't think that they're largely effective. She said, with the exception of one of my care homes, resident councils are completely ineffective the way they currently exist. She explained, it is pretty common for the activity department to lead the resident council. So if I'm not there, what they will do is they will go through and just read, and I mean literally read off the activities calendar, and then they will go back to their bedrooms. They don't even go over complaints. They're telling them the activities for the next month, and that's all they're doing in the meeting. I've got one council that the care home actually does go down the form. How is nursing doing? How is housekeeping doing? They actually put an effort to address these issues that are brought up there. The others, it varies widely. Ombudsman spoke about the importance of their own presence during resident councils. The first thing is that ombudsmen should attend and help resident councils only if they're invited. One ombudsman said, we get ourselves invited. Another ombudsman said that they're asking residents, how are things going with the meetings? Are you being allowed privacy? Are people coming back with answers to your issues? During council, ombudsmen educate residents about their rights and resident council rights. For example, they said, it is their council, not mine, not the facilities, it is theirs, and what that looks like. She added, knowledge is power, so they need to know that this is their meeting, not anybody else's. Ombudsmen also educate administrators and directors of nursing. For example, one ombudsman educated an administrator when she said, look, the purpose of the council is to empower your residents. It is to make you aware about problems in your building before we come and before the state comes with the regulatory book. She added, one of the best tools you have is to make the nursing home feel like you're helping them. It is beneficial to you. It is going to keep you out of trouble if we can help this council really form and prove to them that you are here hearing and changing issues that need to be changed. In one nursing home in Florida, the residents put on the resident council door the following sign, shh, resident council meeting is in session. Please do not disturb. Despite this sign, multiple staff members still came in and out of the meeting without regard to the sign on the door. Residents said that this was a violation of their privacy, and they had made reports to the nursing home staff. The residents voiced concerns with staff that obtaining information discussed during the meeting and reporting it to other staff possibly could result in retaliation. Here's another nursing home in the state of Virginia, where a private resident council was held when state surveyors were attending it. The council started at 11 a.m. 20 minutes later, at 11:20, during a grievance disclosure, a private duty sitter entered the room, probably a private companion. Don't like the word sitter. In any case, residents immediately told this individual, this is a private meeting, and asked this person to place a sign on the door to restrict all staff access and to let the unit manager know this. At 11:30, laundry staff entered with a laundry cart full of clean linen. The same instructions were given to her. 10-15 minutes later, two CNAs entering to obtain a weight scale. Same instruction provided them, and they were both asked to call the unit manager. A few minutes later, another CNA entered, simply walked through without speaking to anyone. At this point, the residents refused to speak further as they feared sharing negative information would result in retaliation, and the meeting was adjourned. By the way, according to the investigation report, the unit manager never came to that meeting or any other manager. An experienced ombudsman described how she addresses some of those staff interruptions during resident councils. I've definitely sat at the back door sometimes to ensure that staff were not walking in because it's amazing how frequently that happens. One nurse came in and gave an insulin injection to a resident during council. The ombudsman asked, how do you educate your staff to not interrupt the resident council meeting, that this is their meeting, that this is their time? I have to often educate that this is not your council. This is the residents' council. They should be able to hold their meeting in a private area or place. Ombudsmen continue to describe how they address staff interruptions. One ombudsman said, I'll put the private meeting note on the door, and then the first step staff will come through. I'll be like, you need to turn around. And then I will actually put that in the notes for the meeting. And I'll even ask for the staff's person's name as they enter. I need your name. And then I will say, you need to turn around and leave. I capture all that in the resident council minutes. A state long-term care ombudsman program said, I throw anybody out that shouldn't be there. I've caught them a lot of times in different homes. Having staff going in and taking a blood pressure or giving them medications, I throw them right out. I tell them, get out. Another ombudsman said, if you could see the attitudes on those staff when they have to leave, because we have to explain to staff, this is not your meeting. Ombudsman said that education is key and knowledge is power. One ombudsman said, staff have this obtuse attitude. It just irritates me that they are entitled to be there in the meeting. To address it, she described two ways in which she does it. She brings a copy of the federal law to council and educates residents about it. And she gives residents the resident council toolkit. Ombudsman spoke about the critical importance of a structured grievance form. One ombudsman said, the biggest thing is making sure that residents have a pathway to take notes and to write down the grievances, and they know who they can bring the grievances to for follow-up. They added, making sure residents have a clear pathway for them to follow. Another way in which staff compromises resident councils is when they try to control it in ways that don't serve the residents or even harm them. Here, in a nursing home in Virginia, a private resident council meeting was held, and a state surveyor was present in it. CNA walks in and says that she's taking notes. The surveyor explained to her that the meeting was intended for residents to meet with the surveyor without staff present. The CNA ignores the surveyor and asks the president of the council 3 times, each time louder, if it is okay for her to be there. The president said okay after the 3rd time. When the surveyor asked if residents felt that they could file grievances without fear of retaliation, one resident said no. The CNA corrected the resident, said that that was not true. The surveyor asked the CNA not to interrupt residents. The surveyor ended up interviewing individual residents separately. You can read more about it in my report, They Make You Pay, and you see the page number here. So staff may control and influence resident councils. For example, staff may say, no, we're not discussing this topic here. Or, oh, we already discussed that in our last meeting. We already addressed it. We are not going to talk about it again. Oftentimes, what you'll see is, hey, tell us what we're doing great. But then they don't want to hear any concerns or complaints. For example, staff will say during council, the food is getting better with our new cook, isn't it? None of the residents spoke up. That staff member was there taking minutes. They are looking for one answer. They provide the answer in their question. They may not feel residents comfortable. The residents may not feel comfortable giving their answer. The ombudsman told the staff member, if I was eating the meal and you were asking me, is it getting better? Is it getting better? Isn't it? Well, you work here. I wouldn't feel comfortable answering. She also educates that staff member by saying, be sure that with each meeting, you're asking the residents, are you okay with me being here for this portion of the resident council meeting? If you guys want to complain in private, I can leave. So that way it's anonymous. One ombudsman said that at times she waits to address issues like that until after the meeting. She said, sometimes we have to do it after the meeting because we might not want the resident to feel pressured, and that's typically my style. She explained that with certain staff, it is clearly not going to work to address it during the council meeting because some staff are just so aggressive, she said. She recognized, however, that this approach may delay addressing residents' care concerns, for example, until the next resident council meeting, which could take place a month later. Ombudsman described how they address intimidation. In one of my assisted livings, the residents were pretty fearful of retaliation because it was like every head of every department was in the resident council meeting. And they're like, oh man, we just feel like there's a target on us in resident council. Another ombudsman said, if the director of nursing is there and is upset that they're getting all of those complaints, you're not going to want to voice that concern. Another ombudsman suggested, if the director of nursing is coming to the meeting, making sure the residents know that you have a voice. You can say, this is our meeting. You are not needed at the moment. If we need you, we'll get you, but this is not for you. One ombudsman said, you can't say speak freely and then having the administrator sitting there for the entire meeting. It's fine if you invite him in and he addresses a problem, but when he is there and that presence is there, it becomes a real problem. Of course, some administrators can be very resident directed and very supportive and cherishing the voice of residents. So of course, there could be that as well. So in one nursing home, an administrator came to the resident council to address minutes from months before. She was demanding who said what. The ombudsman said, I don't have to tell you, it went south very quickly. Everybody clammed up. Nobody had nothing to say. Quite a few meetings after that. Nobody would speak up because they were fearful somehow their name was going to come out. You've just intimidated a group of 50 to 75 residents all in one swoop. One ombudsman said, they are not able to be open and honest about the concerns that they have. If they have facility staff in there, how do you speak up about an aide that mistreated you the night before? One ombudsman used this creative approach whereby he said, we actually started a resident council in the care home on the weekends when there's less staff and pretty much no management there. He added, I would write down all the issues and complaints they have, and then I would be the one that would take it to the administration so the residents didn't have to fear that it was going to come back specifically on them. Let's talk about the critical importance of accurate minutes taking during resident council meetings. The Moving Forward Coalition Guide on Resident Councils include the following statement. Minutes are an important record of what was discussed during the resident council meetings. Once those grievances are put down on paper, it's a footprint for change. I believe that was one of the ombudsmen in my project said. Also, another ombudsman said, you don't even have to give them access to your minutes. You're able to keep your minutes to yourself. This is not part of the nursing home property. This is yours. It is considered your property, not theirs. And you can find a template of meeting minutes in the Moving Forward Coalition Guide on those pages with the link to the guide that I provided earlier in the presentation. So here are some challenges with minutes. Those challenges occur when the minutes are incomplete or they are done in an unreliable way, when they're taken by staff. That is, they're not reflecting residents' care concerns and complaints as voiced during the resident council meeting. One ombudsman said that from the nursing home perspective, It doesn't matter if what's happening in those notes is real, just that when you hand them over to the state survey agency during your annual survey, they read that and it's good enough for them. The ombudsman added, that's God honest truth. Excuse me. Another problem with minutes is is that they is that after they're being written by residents or by the activity director, or they're not being addressed, the care concerns in them are not being addressed from past meetings and from the current meeting. The Ombudsman highlighted the importance of systemic tracking, including the first time an issue was raised. She said, I keep my own notes, so if last month there was a concern and this month it just had magically disappeared and we're not addressing it, that can be something I can assist with. Another problem with minutes is singling out residents. To minimize this possibility, one ombudsman said, I never quote one resident's name. The activity director takes accurate minutes, but when it is given to the administrator edits those minutes, literally takes out things from the minutes. That's another challenge. All activity director minutes are reviewed by the state during survey, said one ombudsman. If there's something that they can't resolve or don't want to resolve or see habitual presence of it, the administrators will remove it from the minutes. If they don't like any of the questions brought up by residents, then they just eliminate that. When I when asked how she knows that the administrators edit council minutes, one ombudsman responded, "We see it because we're now to the point where we take separate minutes where we don't share, where we can see that it's not lining up." She added, "We even got to the point it was so bad in one of the care homes, we audio taped the meeting. We recorded it, and then we gave the recording to the Department of Health. We said, this was the meeting. Compare the administrator's minutes with what was actually said. Don't just take our word for it. Here is the recording of the meeting." This is a story in a situation that happened in a nursing home in Texas, entitled Voiceless in Their Home. In that nursing home, a resident council meeting was not held for more than 6 months. A CNA supervisor who used to be the activity director reported that the former director of nursing actually stole the previous meeting minutes because they had incriminating evidence related to poor resident care. The new director of nursing said, if residents felt they cannot complain, then their quality of life will suffer. She added that she was unaware that residents felt this way. Again, going back to the 30,000 feet approach of some managers. So one ombudsman encouraged residents to ask staff to leave the council meeting if they so choose to if the residents choose that, and to use an iPad to record it. She said, we have a Zoom license through the state. Hit record and let it record what's happening. The recording will be the proof. You can send it to the state survey agency. You can send it to us. Once you start to do that, she said, and they get a little confident around that, we've seen that gets the ball rolling. Of course, confidentiality and privacy issue of certain residents should be taken into account. So you need to consider if it's only audio recording or video. And if it's video, you need to be able to fully protect residents' privacy and confidentiality. Another challenge with resident council meetings is lack of follow-through. One resident said, from what I found, they're notorious for listening without action. And that is sometimes harder than not even being able to say it. A council can begin to feel like a place where people just complain and nothing gets done. People stop coming. These were quotes from the Moving Coalition Guide on Resident Councils. And Elise, from the New Jersey Long-Term Care Ombudsman Program, addressed the issue of lack of follow-up, and she said, this issue represents one of the biggest challenges, and that is why people stop coming to resident councils. That is a big issue. And Alice Bonner, the chair of Moving Forward Nursing Home Quality Coalition, added, that is a huge issue. One ombudsman in my project said, if they're in the thick of all that and you can't get anybody on your side within leadership to care about it or to tend to it, That could be a dangerous situation for residents to suffer more retaliation or abuse. One ombudsman said, people are stuck in the cycle where their nursing home is like, yeah, we're working on it. Or as this ombudsman described it, an endless loop of BS. The ombudsman encourages residents to use a form designed to close that loop, provide a paper trail of the minutes and concerns over time, and increase providers' accountability. He explained, it sets them up to respond to residents' concerns and suggestions for improvement in a more structured way. He added, I love that form for that reason. Speaking about the value of a structured grievance form, his colleague added, surveyors may ask the activity director for resident council notes from the past 6 months, and the activity director has to provide these. She explained. The surveyors can see, for example, with regards to ongoing issues with showers. The residents have brought it up the last 3 months, and it does not look like you guys have done anything to resolve it, because residents are still complaining about it. That, to me, she said, is the value of the structured grievance form. Another ombudsman said, if they didn't respond back in writing, they did nothing. In the last section of this presentation, I would like to talk about negative effects of the physical environment on resident councils. One ombudsman said, that is really a struggle sometimes because some of those buildings aren't built with a room that will hold a council. Another ombudsman, when I asked one of the ombudsmen how often there's really a closed door resident council meetings, the ombudsman said, rarely ever. It's rarely ever private. She added, if they say, I want no staff there, I think they're more likely to have it be private. But for a lot of those care homes, just finding the space to have an enclosed private room is not practical. Another problematic location is in the dining room, very common, which is a high traffic area. And oftentimes it could be held in the dining room or in a room where staff are walking back and forth. Visitors could be walking by. It's not a safe place and it's not comfortable for residents. She added, I'm not sure residents actually know the right to have private space. I think if somebody just gets there and it's been in the dining room all along, well, that's where it is. Some places don't have a private area designated. Another ombudsman said, one of my care homes doesn't have a space big enough. If the building doesn't have a space, I can't create one. Some of these, we've even made referrals to license to the state survey agency, which doesn't get too far, and then I'm stuck. My hands are tied. Or holding the resident council in a small room. Some care homes make the residents use a small room for resident council. They go from the dining room to a small activity room or just to a really small room, and that makes it that instead of 30 residents attending, it goes down to maybe 5 to 7 residents. She added, they do that purposely. I see that absolutely purposely done. It's horrible. She explained, they do that so residents don't have a say in the resident council to bring up concerns. Another ombudsman spoke about the risk of being singled out when only a small number of residents participate in a resident council. She gave the example of 4 to 6 residents. Or when the resident council is held in the hallway. One ombudsman said, if they have to have it at the end of the hallway, those don't have doors on them. I'll see more staff on that hallway during a resident council meeting than 10 visits combined. I know that they are purposely sending staff down there. In one nursing home, the resident council was about to be held in the cafeteria. The cafeteria is not closed in. The ombudsman told them, no, we can't have a resident council meeting out here. There is no privacy, she added. So they had to find us a conference room big enough to accommodate. Noise and how it affects resident council meetings. Sometimes they'll have those meetings, say in the dining room, and the kitchen staff are real good about interrupting. They will purposely leave the door open and essentially make a lot of noise with the dishes in the kitchen, so much that nobody can hear, much less when residents are hard of hearing. Sometimes residents will call and say, we can't even hardly have a meeting. Another ombudsman said, if it's too loud, a lot of those places have the pop machines, the refrigeration. the refrigeration going, and it's really loud. A lot of residents can't hear. She added, I'll basically be like, that gets unplugged. So here's my recommendation in general, kind of high level about uh, um, an appropriate private room for residents to hold resident council meetings. Care homes need to ensure that there is an appropriate size room with a door that residents can use to hold private council meetings if they choose to hold it privately. If such a room doesn't exist, yes, the care home needs to create it. It needs to be large enough, comfortable physically, temperature-wise, glare, any other feature of the physical environment in the room to make it comfortable for residents, and it has to be easily accessible. And the accessibility issue is huge and critical, but it's sometimes overlooked, talking about residents with different forms of disabilities that needs to be accommodated so they can participate meaningfully in those councils. And I just want to highlight a wonderful and innovative initiative in some states. That is the statewide resident council. Several ombudsmen that I interviewed were not aware about statewide resident councils, such as those held in Connecticut and Pennsylvania. When becoming informed about it, one of them said, that sounds kind of cool. Her colleague added, that sounds interesting. I wish we did. So my recommendation is, it looks like there's a need to encourage ombudsman programs across the country to consider starting a statewide resident council. And Mairead Painter, the state long-term care ombudsman program in Connecticut, would be a wonderful resource on this end. And for example, the Connecticut long-term care ombudsman program that has this statewide resident council works on systems advocacy. That statewide council was able to help in passing several bills in recent years that aim to enhance the resident rights and protections of these individuals. For details, I include a link to the Connecticut Long-Term Care Ombudsman Program advocacy webpage. It is also an opportunity to share another innovative initiative that was developed by the same Connecticut Ombudsman Program, which is the Statewide Family Council. In conclusion, there is a great variation in the extent and quality in which resident councils are held and the degree to which they are effective. When resident councils are resident-run, well-run, and there's a strong president who is informed and empowered and organized and professional, and where residents are well educated about their rights in general and resident council rights specifically, and when there's good participation that is ongoing over time, and when those resident councils are fully supported by their care homes, not compromised by the administration, managers, and staff, then they can be a critical asset for elevating the voice of people living in nursing homes and assisted living residences. It can truly be a way to balance the gross asymmetry of power between residents and care homes. When care homes cherish the voice of residents, the council can contribute to improving these individuals' dignity, quality of care, quality of life, and safety. And I just want to share with you a link to a poem that I wrote a couple of years ago that I called Without the Voice of Elders. What can happen when the voice of older adults is not heard when it comes to their care, mistreatment, and rights? There's a 2.5-minute video here that was produced by Elder Voice Advocates in Minnesota, but also the text of that poem and a blog post on changing aging. I also want to emphasize the role of CMS and state survey agencies because insights shared by ombudsmen during this project suggest that the CMS and state regulatory agencies need to strengthen their oversight enforcement to ensure that resident rights related to resident councils are respected and protected. And I want to end with 2 quotes. One is from Courtney, who is an administrator of St. Jude's nonprofit nursing home, where the innovative and powerful Lapeer program was implemented. She said, "Who knows the concerns and solutions better than the residents who live here 24/7?" and an experienced ombudsman shared this reflection question. Referring to resident council, he asked, is it anything more than part of your performance improvement cycle and communication? I want to thank you for joining us today. And I want to end with the last quote that I shared earlier. When an older woman in early stages of Alzheimer's disease who participated in a resident council that I observed, she said that those resident councils are important as long as we know that someone is listening. Thank you, and I hope you found it useful.